I'm in the med room. I'm going to do hand hygiene, and then I'm going to give 15 milligrams per ml of Toradol. I'm gonna scrub the vial for 30 seconds. And then when I'm finished scrubbing and waiting, and after I wait for this to dry, I'm gonna take my syringe and I'm gonna draw up 1 ml of Toradol. Safely uncapping. And I'm gonna do 1 ml of air. 1 ml of air. I'm gonna stabilize my hand. And we're gonna inject the air into the air. And we're gonna get 1 ml. A little bit more than 1 ml. Tap out the bubbles. There we go. And we're going to tap this again, hand behind the back. We're going to put the cap on this. Oh, and we're going to change this needle that I drew up the medication with. We're going to change, I'm going to open the packaging. Can I open the packaging? And we're going to hold the flaps down and securing this on there. We're going to leave that one to the side. For the IM, for this IM Toradol, we're going to give it with a 25 gauge, 1.5 inch needle. Now for the insulin, the regular insulin, we're going to give 10 units. So I'm going to scrub for 30 seconds after I performed hand hygiene. And we're going to use an insulin syringe, which is measured in units. And we're going to give 10 units, regular insulin. Okay, I'm going to wait for that to dry. And hygiene. And we're going to hold on to the safety so that doesn't release, and the plunger. So we're holding the plunger, holding there, and we're going to take that off. We're going to do 10 units. 15, 10. Pull back to 10. Then we're going to brace our arm. And then we're going to do 10 units into the into the vial. We're going to do 10 units of air. Hold the plunger, invert, and then draw 10 units of insulin, regular. Bring this back down. Make sure we tap out. And then we're going to cap this. Actually, we're going to do that. Dominant hand. And we're going to hold it here and put the cap on. So we have our Toradol ready, and we have our insulin ready. I'm going to take these to the patient. Hi there, I'm Natasha. I'm going to be your nurse today. I've got some meds here for you. I've got 15 milligrams per milliliter of IM Toradol. And I've also got here for you 10 units of regular insulin. So to find the, you're going to have to come to this side. To find the deltoid injection site, so to find the deltoid injection site, we're going to find the acromion process, and then we're going to go 2 to 3 fingers width, fingers width down. And if we had our patient with their arm out, my thumb would go from the axillary crease and create a V. So from the acromion process, 2 to 3 fingers down, and we're gonna go from the axillary crease to the middle, and right there with the V, that's where I would inject for the deltoid for an IM. I'm gonna uncover you up a little bit, and we're gonna find the vastus lateralis side. We would have them turn. I'm gonna have you turn on your side a little bit. We'd have them turned on their side. Thanks. And I'm gonna use the palm of my hand with my right hand to the left leg. We're gonna go and find the greater trochanter. From the greater trochanter, 1 hand's breadth from the greater trochanter and a hand's breadth from the knee, so about here. We're gonna go to the second third of the anterior lateral vastus lateralis. Anterior lateral, we'd give the injection of the vastus lateralis here anterior laterally. And we're gonna bring your leg back down. For the ventrogluteal, I'm gonna give it with finding the greater trochanter again. So I'll find the greater trochanter about here, which is just below like the head of the femur. We're gonna find we're gonna find the greater trochanter. Oh, with my non-dominant hand. So this is gonna be left hand to left leg. We're gonna find the greater trochanter. And here's the iliac crest. Anterior superior iliac spine. The index finger is going to be pointing towards the anterior superior iliac spine, and the middle finger will be pointing towards the iliac crest. So in between there, so we're not necessarily going on top of it. We're going to give the injection in between this area right here. That is the last IM site. So, sir, we're going to roll up your sleeve, or ma'am. We're going to do hand hygiene. And again, for the deltoid injection, we're going to find acromion process, 2 to 3 fingers down. And we're going to go V, inverted V here with the axillary crease. And we're going to do right there for the deltoid injection. So I'm gonna clean this site off now that I have found it. And leave it there so we can keep our site. We've got our 15 milligrams per mil of Toradol. And we're going to And then I'm going to use Z-Track and displace the skin. Inject. Bring it out. And then let go so that the skin goes back. And I'm gonna put my hand behind my back. We're gonna cap this. Hand hygiene. Next, we're gonna give you your insulin in your abdomen. I saw on the charting that you have not had insulin in your abdomen. The other insulin was previously given in other spots, so we're just gonna uncover you up a little bit here. So we're gonna clean this site. And the deltoid IM was given at 90 degrees. This one will be given at 45 degrees. So if you can pinch an inch, it will be given at 45 degrees in the subcutaneous. So here we've got our 10 units of insulin, and we're gonna hold in here so we can hold the safety. You can pinch an inch. We've waited for this to dry a sufficient amount of time, and we're gonna go 45 degrees. Thank you. We're gonna cap this back on here again. And we're gonna throw these in the sharps container, clean up. Thank you. We're gonna cover you back up here. Make sure that you've got your call light in place. We're gonna bring your bed back down to the lowest position. Having any pain? Need to use the restroom? No? Okay, you've got your possessions here. Thank you. All right, that's it for the meds that I need to do. That's it.